sweetie, just have a seat right there and I'll be with you in just a second. Getting an intake form pulled up for you. Perfect. What brings you into urgent care today? Okay. Well, you definitely came to the right place. With symptoms like those, have you noticed a fever in the past 24 hours? Okay, great. So let me go ahead and get your first and last name. And your date of birth. Okie dokie. And your home address. I know it's a pain. It's just if you've not been here before, we don't have your record on file. So, yeah, it's not too bad. It goes by pretty quick. Okay. And a home phone we can reach you at. Perfect. And do you have a cellular? Wonderful. Perfect. And do you have a social? Okay. Perfect. Okay. And we won't have to check about weight and height today. That's perfectly fine. Is your primary language English? Would you need an interpreter otherwise? Okay, wonderful. Marital status? Single, married, divorced? Okay. Perfect. And emergency contact. Do you have someone in mind? Wonderful. And who are they to you? Perfect. And a phone number to reach them at. Perfect. And then, do you have insurance? Perfect. Can I just get those cards and I'll scan those in to the system? Thank you so much. Okay, let's see. Okay, and this is your primary care physician? Back to you. And do you have any known allergies? So typically medical allergies, medicine, things like that. Great. And are you currently taking any medication? Perfect. And what do you take that for? Okie dokie. Perfect. Okay. And do you have any pre-existing conditions that we need to know about? Is it intake form? They make me go down the line. Anemia. Just give me a yes or no. Yeah. Anemia, arthritis, asthma, AFib, bleeding problems, hyperplasia, coronary disease, any type of cancers, cardiac arrest, previous heart attacks. Okay. Celiac, chest pain, chronic chest pain. Okay. Congestive heart failure, chronic fatigue syndrome, depression, diabetes, any drug or alcohol abuse. Okay. Fibromyalgia, GERD, heart disease, hypertension, high blood pressure. Okay. Hyperthyroidism. Okay. Insomnia, irritable bowel syndrome, kidney problems, migraines, headaches, neuropathy. Okay. Pulmonary embolism, any history of that, seizures, shortness of breath, past strokes. Okay. Okay. And any conditions that I didn't name that you have. Perfect. Okay, so go ahead. I'm going to get started on your vitals. And I want you to just go ahead and tell me when, just tell me a little bit more about your symptoms, when they started. Okay. Oh, honey. I understand completely how you feel. Not being able to breathe because of a stopped up nose and running throat is the worst feeling, let me tell you. Okay, well, let me go ahead and I'm going to check your temperature. I know you said you haven't had a fever. So just hold out your tongue, I'll put it under your tongue for you. But no, those are, I understand completely. Well, not an emergency case. Usually it's, it's unbearable after a few days when regular over-the-counter stuff isn't working. Okay. Perfect. So you don't have a fever right now, so that's great. Okay. And have you tried anything that makes it any better? Some people think they've tried hot compresses around the sinuses, sinus massages, around here or around here. Okay. Okay. Right. And have you noticed any other things along with the drainage and the headaches, like muscle cramping, dull pains throughout the bodies, numbness, spasming, any kind of throbbing or tingling feelings? Okay, any fatigue? Yeah, okay. Perfect. Okay. And do you notice any time that these symptoms are worse or better? Worse in the morning. Okay. Okay. Yeah. Okay, so they alleviate as you go throughout the day, but it's still difficult. I completely understand. Something an old a nurse friend of mine taught me was most people have a lot of deviation in their sinuses. It just happens through growing up, sports, sometimes you're born with it. But just adjusting it. Mine adjusts a little bit this way. Already breathing better. But I can't afford a nose job, so here we are. But that seems to help sometimes if you have that. So, I'm going to go ahead and just take a look in your mouth. You said you had a sore throat, so just say ah for me. Ah. Okay. I'm going to go ahead notice any pain or drainage? Right. Okay, let's check this here. Okay. There's a little bit of redness. Yeah. It's not terrible. Like you said, you haven't really experienced too much pain with that. So, right. Okie dokie. Great. I'm just feeling out your note as we go. It's just easier that way. That way we can get you in and out quicker. So, absolutely. Okay. Well, I'm going to just check a couple more things. And I'm fairly suspicious of what we've got going on here. With the weather changing, this new storm, of course, coming through, everyone's gunk is messing up. So, and that reminds me, I had to ask you one. Everyone gets a little squeamish. Have you noticed you're bringing up anything yellow or brown? Or just, okay, perfect. Alright, go ahead and just relax for me. I'm just going to check a couple more things we just have to check off the list. So, just relax and look right at my nose. Okay. And the other one. Check the other eye just one more time. Okay. I think that's okay. Now, do you mind if I just touch you for a second? Perfect. I'm thinking, so does it hurt when I press here? It's a little tender. Okay. What about over here on the nose? Okay. Okay. Yeah. Alright, we're going to run just a couple small tests on you. And we're going to do a flu and strep, and a COVID. So, it'll be just 2 simple swabs. One will go up your nose, and one will go to the back of your throat. It's really easy. You probably haven't done it 1,000 times before. Right. So let me just put the order in here, and we'll just do them right here. We'll get them out of the way. Urgent care. We pride ourselves on trying to get you in and out as quick as we can. Absolutely. Okay. So, 2 tests. It'll be quick. So, first one, like I said, it's going to be a simple. We're going to just open wide, say ah, I know, almost. I know. Okay. That wasn't bad at all. So, send that off to the lab. It's an instant. They'll take it over here across the hall. And we'll do, that's for your strap. And now we'll do for your COVID and your flu. So, alright, so just lean your head back for me. I know this is really uncomfortable. So when I tell you to, just breathe out, okay? And breathe out, breathe out, breathe out, breathe out, breathe out, breathe out, breathe out. Okay. And we'll do the other side. And breathe out, breathe out, really well. Wonderful. Alright, we'll get these set off right now. But no matter what they are, we're going to go ahead and give you, we're going to give you a steroid booster, and this is going to, your body is naturally healing itself, and of course, we'll send you with some cough syrup too, but the steroid will help you really kickstart your immune system back into, instead of 7 days for this to get past, you could get past it in 2 to 3, maybe even less, depending on how your body fights back. Yes, exactly. So, are you, I believe I already asked you, are you allergic to any medicines though? Perfect. Okay. And, what pharmacy do you use? Perfect. Okay. And it won't let me send it to form until I ask, do you consume caffeine? Who doesn't? I live off Monster Energy. Don't do what I do. Do as I say. Frequently, how frequently do you exercise? Daily, weekly, occasionally? Okay, and are you currently on any special diets that aren't typical? Some people do keto, some different things like that. Okay. And you already asked about alcohol and drug use, tobacco use. Okay. Perfect. Alright. Wonderful. Okay, let's get these results back as quick as that. So, okay, yeah, so it's a negative on the COVID and flu and negative on the strep. Perfect. So you're good to go there. Wonderful. So I'm going to go ahead and just give you the booster. So which arm would you prefer it in? Wonderful. Okay. I will just we're just going to put the alcohol pad. Perfect. Dump that in the trash. And then we're just going to do the injection. So big poke. 1, 2, 3. Wonderful. Then we'll go ahead and we'll just put a little bit of bandage over there. So let's see. And here we go. Alright, perfect. Well, I think that is all that I have for you today. I really hope you start feeling better. It's a sinus infection. Call in some other steroids and some cough syrup, fancy cough syrup. A little bit stronger than what you can get with Tylenol over the counter. If you start feeling achy pains, Tylenol will help. If you get any worse, if you start spiking a fever that won't go down with Tylenol after 24 hours, come back, or if it gets too bad, go to the emergency room. Absolutely. We are always here. We're here Monday through Saturday. And if, like I said, if it's too bad, go to the emergency room. So, absolutely. Thank you for coming into the Urgent Care Clinic. I'm so glad I could help you. I will get this medicine sent over to your pharmacy. And I hope you start to feel better, sweetheart. Yeah. Of course, anytime. Okay, let's get you out of here.